We have an extra 20 or 30 or 40 years, and we have no idea what to do with it. So I often say that science has done its part, and in many ways, social science has failed. We have failed to change our institutions, to change our culture, to adapt our thinking to these longer lives. We think that education should simply be the province of people between 0 and 25. I think that's crazy. I think we should be learning throughout our lives. We think that work should be the province of people, in their 30s, 40s, and 50s, and that we should start this kind of long, inexorable decline. I say that's crazy, that we should be able to, not required to, but be able to work and contribute and volunteer throughout our lives.
Hello, and welcome to Not Born Yesterday, a podcast dedicated to older adults and the challenges and joys of aging. I'm Miriam Goodman. Not Born Yesterday is an award-winning program providing expert advice on issues related to older adults, their adult children, and anyone who works with or lives with elders.
Not Born Yesterday is brought to you by Next Village SF, providing services and support to older adults, and the Fromm Institute for Lifelong Learning. I'm Lynn Winter-Gross.
Today on Not Born Yesterday, we're examining a topic that keeps popping up in conversations and in the media, the issue of longevity and how it is creating a revolution in how we think about aging. The stereotype of decline and dependency in older age is challenged daily, and the growing numbers of seniors who are continuing to contribute to society is a sign that this is not your parents' retirement. Our guest, Paul Irving, is a senior fellow at the Milken Institute, a nonprofit think tank that strives to improve lives around the world. Mr. Irving previously served as the Institute's president and founding chair of its Center for the Future of Aging. He's a thought leader on aging and author of The Upside of Aging: How Long Life is Changing the World of Health, Work, Innovation Policy, and Purpose. The book explores how the changes in aging have important implications for elders today and in the future.
Paul Irving, welcome to Not Born Yesterday.
Miriam and Lana, it's a pleasure to be with you both.
With lifespans getting longer and experts predicting many will live beyond 100, we need to plan differently. What should we do and how should we begin?
Look, what we know is that ageism in many ways affects every part of our society, our businesses, our policies, our culture. And those external factors also weigh on us internally. And so what we've learned is how we are above the neck is just as important as how we are below the neck. So we know that exercise and nutrition and engagement and avoidance of social isolation and ongoing stimulus and a sense of purpose are really important. But what we also know is appreciating our aging, understanding, not being Pollyannish about it, understanding the challenges of aging, physical and cognitive decline that ultimately happen. Some of the things that we may not be able to do that we could do when we were younger, but new things that we can do that we couldn't do when we were younger, and appreciating the phases of every part of life, young, middle-aged, and older.
So we're all baby boomers, and we remember how we all thought that we could change the world. And in some ways we did. We transformed the thinking on sexism, on racism, on health and technology and other benefits to society. So how can we bring that sense of reinvention and reimagining that we brought to society maybe in the 60s in a way to continue this transformation that leads to longevity?
It's a really good question, and one I've thought about a lot. Look, I mean, ageism is the last, in many ways, acceptable ism. We've taken on racism. Obviously, we haven't solved it. We know that in the wake of the Civil Rights Act in 1964, we did not eliminate racism, and we still have challenges in our society. 50 years ago or so, the modern women's movement sought to create pay parity for women. We're not there yet, but we have certainly made progress, and we know that other parts of our culture, of our diverse society, have made progress. We should take it on, Miriam. I mean, this is one of those things that we should see as a movement, and I think many of the people in my field do. We have a sense not only that we should be focused on elevating healthy longevity and on democratizing interventions that can ensure that people live healthier and happier and more productive lives, but also that we need to change culture. We need to change society. We need to advocate for older workers. We need to ensure that our media portrayals fairly and accurately represent the diversity of older adults who, frankly, are just as diverse as any other part of the population. Chronological age is an absurd measure of anything, frankly, in the wake of the decoding of the human genome. We know that people age in very different ways and at different times. I mean, look, death rates remain consistent at 100%. None of us are going to leave this world standing up, but there are people who are wonderfully productive in their 70s and 80s and 90s, and we all know that there are people who are unproductive in their 30s and 40s, and this is not intended to in any way suggest that younger people aren't capable. In fact, what we really know is that we should be looking at people as individuals at any age. And younger people are oftentimes subject to ageism as well, right? We sometimes think of millennials in ways that somehow trivialize their contributions, their level of seriousness, and all the rest. But they're a very diverse population as well. So the bottom line is, it shouldn't be about age. It should be about who we are and what we're able to do and accomplish and contribute to the world.
So how do we do the same thing for age?
I think it's increasingly recognized that older people have different kinds of skills and abilities to contribute to workplaces, to communities, to educational institutions, and all the rest. There is something to wisdom, and there's clearly something to experience.
Are we seeing that more? What I hear is that older people cost more and they don't bring the advantages that younger people are. Are you seeing that more in industry?
Yeah, well, look, we again can't be Pollyannish about it. Aging is the principal risk factor for chronic and neurodegenerative disease. So what we know is that older people are typically more expensive medically, but they also may be less expensive in terms of their, for example, reduced rates of absenteeism and presenteeism in workplaces, their sense of loyalty and the likelihood that they will stick. It's very expensive to employ and re-employ people. So people who stick around and appreciate their workplaces are particularly valuable. And by the way, younger people say that. There's a narrative out there that suggests we're in a generational war and all the rest. And obviously, there are some generational stresses. But it's interesting when you talk to young and old people who work together, what you find is a great sense of satisfaction and reward that comes from that. And frankly, again, increased productivity, creativity, and performance.
Well, along those lines, what would motivate a company to have an intergenerational workforce, and
Sure.
that would transfer into society, I assume?
Yeah, well, I mean, there are lots of, frankly, very obvious reasons. Let me just give you a few, but I could probably give you 24. First, we are looking, as you two know very well, we are not just part of an aging society and frankly an aging global north, but we're also very much part of a society in which fertility rates are at unprecedented historic lows, which is why many institutions these days we see low rates of unemployment, et cetera. Part of that is due to the challenge of simply not having enough workers. We all grew up at a time when we remember concern about the population bomb. More typically these days, people are talking about the population bust. But I always say to people, the fact that I've got this doesn't mean that I'm less productive, less valuable, somehow less worthy than I was when I was younger. It just means I'm different and I perform in different ways. So we have to be open to this notion of a new demographic reality, and employers have to understand that they have a need to retain people longer and in new ways. that they benefit from that in multiple ways because, frankly, their customer base is getting older, their consumers are getting older.
I wanted to get
But
back a little bit to longevity for a minute
sure.
because we've heard the phrase silver tsunami. And I always say that that doesn't make any sense because a tsunami is something you aren't expecting. It comes suddenly. And the fact that people are living longer should not have come suddenly to people who study age, who study the future, who study products, everything that we've talked about, who study employment. So it seems that there's almost like a backlash to the fact that we're all living longer. And I would just wondered if you had ideas on how we can deal with that.
Well, look, think about it. It's crazy. So there are two issues here. One is a question of demography, right? Population aging, and the other is the question of our individual aging and how we experience a longer life. We tend to measure longevity two ways. One is from birth, and the other is from oftentimes from 65. And what we realize is that people live in their mid-60s. They're very likely to live into their late 80s or even 90s today. And so the paradox is this advancement in longevity is really the greatest achievement in the history of human endeavor. We have an extra 20 or 30 or 40 years, and we have no idea what to do with it. So I often say that science has done its part, and in many ways, social science has failed. We have failed to change our institutions, to change our culture, to adapt our thinking to these longer lives. We think that education should simply be the province of people between 0 and 25. I think that's crazy. I think we should be learning throughout our lives. We think that work should be the province of people, in their 30s, 40s, and 50s, and that we should start this kind of long, inexorable decline. I say that's crazy, that we should be able to, not required to, but be able to work and contribute and volunteer throughout our lives. Your question about the 60s and our activism, well, we have things to do. We have a world to improve. We have a life to make better for our kids and grandkids. We have a future that we should be making better for future generations. So this notion that somehow these additional years are a burden as opposed to a wonderful benefit and opportunity is just crazy. And I think an increasing number of people are recognizing that, but it's not recognized widely enough. So if we want to realize the blessings of longevity, we both have to change culture, institutions, and all the rest, and we have to ensure that better health, better opportunity, continuing education, dignity, and reasonable living conditions are available not just to those of us who are lucky, but those of us across our society.
You've talked about purpose in the beginning, about adults finding purpose, and you've also talked about going back to school and education, but not just for older adults in their own classes, but for intergenerational advanced education. How do adults figure out after they've retired what to best do to continue living and to continue to be involved and to make a difference and to stay stimulated?
Yeah, it's a good question. So I'm one of the things I'm most interested in is championing the notion of lifelong learning. There's another emerging phenomenon that we see on campus. Actually, two of them. One is the integration of living and learning. So a series of places, most famously a place called La Salle in Massachusetts. There's a living and learning community in Phoenix at Arizona State University, and there are some others where older adults live adjacent to campus and take classes with other students. I think that model is wonderful, needs to be replicated across the United States. These are programs where people either live on campus or next to campus, spend a year in some cases a little bit less, fully engaged in university life. And I think that this should be the model, not just for the elite universities, but all universities, colleges, community colleges, and frankly, even potentially even in high schools. Not surprisingly, people find their peers interesting in these programs. They find faculty interesting in these programs. The revelation is the relationship with students. they're incredibly meaningful and valuable, both to these older fellows, these older participants, and to the students themselves, who, of course, are able to have conversations that they may not feel comfortable having with their parents. And the same thing in many ways for the older people may have be willing to have conversations they may not be willing to have with their own kids. So again, this is one of those things that demonstrate, I think, the incredible value of intergenerational connection.
Well, you've written recently about how the younger generation is unhappy. And one of your solutions is cogeneration, working with older people. How does this all evolve?
Yeah, let me invoke our terrific Surgeon General Vivek Murthy, who himself has experienced loneliness and isolation and has written about it and put out a really important report that I would commend to your listeners. And what we know is that isolation and loneliness is not just a small problem. It is literally a pandemic in the United States in many ways, not as well understood, certainly as COVID, but in many ways just as serious. And we can understand some of the things that created social media, which should be something that connects all of us in many ways, can be isolating. Obviously, the COVID pandemic had people physically and socially isolated in ways that haven't been experienced for 100 years. And what we found, what research has found, is that younger people were more severely affected by this, and that's understandable in some ways. Some of these things are matters of first impression for them. Older adults have their resilience is kind of understandable. You know, they've had loss, they've suffered the death of family members and of friends. They've understood failure. They've come to accept themselves in whatever ways they are. I mean, how can at our age we believe that we've left the world a better place than we found it? So we have an obligation, I think, to the next generation, and part of that obligation is to do something to address their sense of loneliness and isolation and the things that lead to acting out in ways that are harmful to themselves and oftentimes harmful to the larger society. Again, what I think Miriam and I both agree about it, that is to leave the world a better place than we found it.
Well, thank you so much for this interesting conversation. I think our listeners hopefully will look at aging differently now. Our guest was Paul Irving, author of The Upside of Aging.
It's a pleasure to be with you both.
Today on News You Can Use, we're talking about medical appointments. Why this topic? Because it seems too many older adults don't use this time well. And in fact, many are not entirely honest with their physicians. According to livestrong.com, people of all ages are not always ready to reveal things at medical appointments. So we want to remind you that doctors have seen it all and won't be shocked when you tell them about your tobacco, recreational drug, or alcohol habits. If you are dishonest or think a certain situation is not relevant, you may be endangering yourself when it comes to treatments or medications. For example, there are risks to vaping and drinking. If you don't reveal that you're doing it, your doctor's prevented from understanding your lifestyle. They are not there to judge, but to keep you healthy.
You will probably be asked about surgeries and medications. And although you may want to keep some of these things private, they're essential to your health care. When it comes to medications, be sure to include all your meds you take, as well as supplements, such as vitamins. Even though you don't need a prescription for these, some supplements can affect your medications or symptoms. For example, we heard that too much vitamin K can interfere with blood thinning meds. Others can damage your liver. So be sure to mention all the supplements or take a photo of the bottles and bring them to your next visit. And don't think you'll automatically get antibiotics just because you want them. Some people think they can cure everything, but in reality, antibiotics are for viral infections and they won't help your cold or COVID. And as you probably know, antibiotic resistance is a risk.
We realize that visiting the doctor can be intimidating, especially as we age and don't know what is normal and what is worrisome. Your physician wants to help you, so honesty is a must. Depending on where you live, getting an appointment may not be easy. Plus, there may be long wait times, paperwork, and insurance approvals. When you finally are face to face, it's fine if you have a list of concerns and questions. And don't be afraid to make another appointment if you're worried about something, forgot to mention something at your initial appointment, or if symptoms crop up after your checkup. Staying home and worrying won't help.
And that's our podcast for today. Our thanks to our guest, Paul Irving. You can learn more about Next Village SF at their website, nextvillagesf.org. Our theme music is from Hook Sounds, and Jason Dahlstedt is our engineer. And thank you for listening. We'd love to hear what you would like us to discover and discuss. Please contact us at notbornyesterdaypodcast.org. Follow us on Facebook and Instagram, and subscribe wherever you listen to these podcasts. All of these are free and help us to know our audience better. Be well, stay strong, and remember, you weren't born yesterday. I'm Lynn Winter Gross.
And I'm Miriam Goodman.